Welcome to the Preventing Distressing Behaviors in People with Dementia training for first responders, presented by Idaho Commission on Aging and Idaho's Community Care Program. Summarizing Intervention Techniques, Module 5. Now that we've learned the basics of working with people with dementia, let's review the techniques being demonstrated. In the previous 4 modules, we discussed common dementia challenges, stress responses in dementia, avoiding stress responses in people with dementia, and intervention techniques for working with dementia patients. Now let's watch a full scene unfold involving emergency care service worker Todd and see how it goes.
911, what's your emergency?
My wife Rose has fallen and I'm not able to get her up. I'm worried I'm going to hurt her. And she's not being very cooperative. She was diagnosed with dementia 2 years ago and she knows what's going on, but I don't want to make things worse.
We should be able to get a unit out in about 10 minutes.
Medic 17, dispatch, respond to 208 South Jackson Street for an injury from a fall. Patient is 77-year-old female with complaints of knee pain and a history of dementia. May be uncooperative with responders.
Dispatch Medic 17's en route.
Oh, thanks for coming. I think she hurt her knee. She's had dementia for a couple of years, but
Okay.
she's pretty lucid.
Okay, sounds good.
Come on in.
Hi, Rose. Looks like you took a bit of a fall. We're here to help you. You hurting anywhere? You able to move your arms and legs at all?
Why would I tell you? Curtis, this man is trying to help me. I want you to help me.
Remember, I told you I was calling them to bring you to the doctor.
This is nonsense. I'm fine. I just had a little spill is all.
Rose, it's really important that you answer my questions. Are you hurting anywhere?
I'm hurting everywhere. I'm old, okay? I don't know why you feel like you can come into my house and ask me so many questions. Curtis, can you please tell this man to leave? I want you to help me.
Well, I'm right here, Rose. We're all here to help you get to the doctor.
Stop making a spectacle. I'm fine. I just twisted my knee is all.
Todd was in a hurry and forgot to use the positive physical approach when working with this patient. As a result, the patient felt overwhelmed and went into freeze mode. Let's watch the scene again with Todd slowing down and using the positive physical approach.
Hi, Rose. My name's Todd. I'm a paramedic. Curtis called me because it sounds like you took a fall and hurt your knee. He wanted me to take a look at you.
Where's Curtis?
Oh, I'm right here, honey.
Oh, okay.
Do you remember how this happened?
It's none of your business. This is my home.
I know it's your home and I want to respect that, okay? I just want to make sure that your knee is okay and you didn't hurt anything else.
I'm fine. I just had a little spill out of the chair is all.
Rose, can I place my hands on your knee just to make sure that it's not more hurt than we can tell right now?
I'm fine. I'm just fine. Curtis, can you please tell this man I'm fine?
Rose, we need to let the paramedics do their job.
Curtis wanted me to make sure that your knee was okay, so that it doesn't bother you for the rest of the day, okay? Can I place my hands on your knee just to take a look at it?
Okay.
Okay. Does it hurt at all where I touch?
No.
Okay. This looks like a really uncomfortable position on the ground. Can I help you into the chair behind you?
I guess so, yeah.
Okay. Here, let me give you a hand. And we'll just stand up, and we'll just have a seat in the chair, okay? Take it easy.
Okay.
There you go.
Yeah.
There you go. Now, Rose, can you tell me your last name?
Sampson.
Okay. If I were to send you a postcard, what address would I send that to?
208 South Jackson Street.
Okay. Curtis wants me to evaluate your knee and also wants a doctor to evaluate your knee in an emergency department, okay? Now, we can have you back in your house in a few hours.
Okay.
Okay? Can I take you to the hospital so that doctor can look at your knee?
A doctor?
Yes, ma'am. But like I said, we'll be back here in a few hours.
Okay, I guess it'll be all right. Can Curtis come?
Curtis can absolutely come. As a matter of fact, he could sit next to you in the ambulance.
Okay, I guess it's all right then.
Okay. You able to take a step outside to our ambulance? It's just outside the door.
Guess I can try.
Okay. Here, go ahead and take my hand.
Please.
Using the positive physical approach and slowing down to take his time, Todd was able to transition Rose safely to the vehicle. Next, we'll follow Dawn as she arrives on the scene of an institutional care setting. Here, the care team has identified a resident, Jack, who is acting out of character and is also showing physical symptoms, so they've called EMS as a precaution.
911 Emergency Services.
Hi, this is Jenna at the Senior Living Center. Yeah, we have a resident here named Jack who's a couple years into his dementia diagnosis, and normally he's pretty stable, but today he's acting kind of agitated and paranoid. He also has some physical symptoms, so if you all could come down and take a look at him, we'd really appreciate it.
I've got your address and we'll dispatch a unit right away.
But you didn't keep her, did you? Objection!
Sustained.
About a week later, you asked my client to pick you up.
Hi, Jack. My name is Dawn. I'm with the paramedics. We're here to take you to the hospital. The facility wants you to go see a doctor. Can you tell me what's going on?
There's a lot going on. There's a lot, always a lot going on.
Are you
all the
having any
time.
chest pain? Do you have shortness of breath?
I don't.
You look a little
I'm
sweaty.
not sure. Well, what,
Okay, I'm going to reach down and check your pulse here, okay? So we need to take you to the hospital. The facility wants to have you checked out.
I don't.
They want you to go, so we're going to take you into the ambulance to go to the hospital and have a doctor take a look at you.
No, I can't. I can't do that. I can't leave.
Why's that?
There's ice on the floor. There's ice all over the floor. I can't. It's too slippery.
There's no
It's
ice
too
on the
slippery to
floor,
go.
Jack.
No.
We're gonna
Yes,
take
there
you to
is
the-
ice on the floor.
There's no
I
ice on
see
the
it.
floor.
The ice on the floor.
Jack?
No.
Can you calm down just a little?
No.
Okay.
You're threatening me. I don't want to be.
I'm not threatening you.
I'm not a fool.
Calm
You're
down.
asking me to endanger myself.
I'm not asking you to do anything that's dangerous. I just need you to come to the hospital.
Yes,
okay?
you are.
We're going to take you to the hospital.
No. You think I'm a fool?
I do
I'm
not think
absolutely
you're a fool,
not a fool.
but I think
don't
you
have
need
to
to come
deal
to the
with this.
Dawn started by using the positive physical approach, but she missed opportunities to control environmental stressors. She also forgot to act like a friend, taking time to explain the steps instead of being a boss. She also didn't validate the patient's reality, even though it didn't make sense. When Jack showed fear about the slippery ice, Dawn denied his reality instead of diffusing the situation and redirecting. She infused it with more information for the patient to react to. Subsequently, Jack went into fight mode. Let's watch Dawn approach the patient again, this time using repeat, reframe, redirect to intervene.
She's a keeper, but you didn't keep her, did you? Objection!
Hi, Jack. My name is Dawn. I'm with the paramedics. They've asked us to come check you out. It's nice to meet you. Jack, I'm going to turn off the TV, okay? So, can you tell me what's going on today?
I'm not feeling very good.
Okay. What does that mean?
I'm kind of hot and nauseous.
Have you been feeling nauseous all day?
Yeah.
That doesn't feel good. We'd like to take you to the hospital to get checked out. Does that sound okay?
Well, I don't. I can't leave. I can't go anywhere because all the ice on the floor.
The ice.
It's very slippery.
Yeah, and you're concerned.
Yeah.
Okay.
Yeah.
What can I do to make you feel safe on the floor?
Well, I don't want to fall.
Okay. What if I helped you?
Yeah.
Yeah.
Just don't let me fall.
I won't let you fall. Can we get you your glasses or a coat or something?
Well, maybe a coat.
Okay.
Because you don't know what the weather's going to be like.
Sure.
You know.
Sure. I'll help you stand up and we'll get your coat. Is that okay? Great.
Dawn showed Jack she's a friend, not a boss. She validated his reality, but redirected him by offering him an illusion of choice that made him feel more in control. She slowed down and took her time in order to gain the patient's trust. You have now completed the Preventing Distressing Behaviors in People with Dementia training series. Thank you for your service and the work you do to keep people living with dementia safe and healthy with enhanced quality of life. This training is produced by the Idaho Commission on Aging.